Do not resuscitate, DNR. Policies are an important part of end-of-life care in hospitals. They deal with situations when a person's heart or breathing stops, and a decision is made not to attempt resuscitation. This topic is emotionally sensitive and medically complex, requiring honesty, compassion, and good communication between doctors, patients, and families. A DNR order means that if the heart stops beating or breathing stops, the medical team will not perform cardiopulmonary resuscitation, CPR, or use machines to keep the person alive. This choice is not made lightly. It is usually based on the patient's wishes or on the professional judgment of doctors when they believe that recovery is impossible and medical efforts would only prolong suffering without real benefit. The main goal of a DNR order is to respect the patient's autonomy and to ensure comfort and dignity at the end of life. It recognizes that sometimes resuscitation can cause more pain than help, especially when a patient is already suffering from a terminal illness such as advanced cancer or severe heart failure. In such cases, patients may prefer to spend their remaining time peacefully rather than go through painful and invasive procedures that only extend the dying process. However, having a DNR order does not mean that all medical care stops. Patients with DNR orders continue to receive full medical attention, including pain relief, control of symptoms, nutrition, antibiotics, and emotional or spiritual support. The difference is that the focus shifts from curing the disease to maintaining comfort and quality of life. It is a common misunderstanding to think that DNR means do not treat. In reality, it only means do not perform resuscitation if the heart or breathing stops. All other forms of care continue. Establishing a DNR order requires open and compassionate communication. Doctors, patients, and family members need to discuss the medical condition, the likely outcome, and what resuscitation would realistically achieve. When possible, the patient's own preferences should guide the decision. If the patient is unable to communicate, the family or a legal representative is included in the discussion. Physicians must ensure that the family fully understands the medical facts and consequences, and that the conversation happens with honesty, empathy, and respect. Sometimes a team of healthcare professionals, doctors, nurses, social workers, and ethics consultants work together to support the family through this process. Documentation is also very important. Every discussion and decision should be recorded carefully in the patient's medical file. Once a DNR decision is made, it must be signed by both the attending physician and the patient or their representative. Hospitals often require specific forms to be filled out. The DNR status should be clearly visible in the patient's record and communicated to all healthcare staff to avoid confusion or unwanted medical interventions. This ensures that everyone involved respects the patient's wishes and follows hospital policy. From an ethical point of view, DNR decisions involve balancing the benefits and burdens of medical treatment. Doctors must ask themselves whether performing CPR would truly help the patient or simply prolong suffering. Medical ethics are guided by three key principles: autonomy, respecting the patient's choices; beneficence, doing good; and non-maleficence, avoiding harm. Legally, most health systems require DNR orders to be properly documented and signed to protect the rights of both the patient and the medical staff. Even with these clear guidelines, DNR orders can still cause emotional difficulty. Families may disagree about what is best for their loved one, or they may feel that agreeing to a DNR means giving up. Doctors and nurses may also find it hard to discuss the topic because it touches deep emotional and moral feelings. Education and open discussion are essential to address these fears. Patients and families should understand that DNR does not mean neglect, pain relief, comfort care, and emotional support will continue. When disagreements arise, hospital ethics committees or legal advisors can help ensure decisions are made in the patient's best interest. Cultural and religious beliefs also play a big role in how families see DNR decisions. In many Muslim communities, life is considered sacred and is viewed as a trust from God. Preserving life is a duty, but Islam also teaches that when recovery is no longer possible, there is no obligation to use artificial means to delay death. Seeking medical treatment is encouraged, but it is not required if it brings no real benefit or only adds to suffering. The DNR issue has been discussed deeply by Islamic scholars because it is directly connected to the sanctity of life and the principle of preserving the soul, which is one of the main objectives of Islamic law. From an Islamic point of view, life is precious and must be protected. However, Islam also recognizes that death is a natural part of human existence and that it should not be unnecessarily delayed when recovery is impossible. Islamic scholars agree that if trustworthy doctors determine that treatment or resuscitation will not change the outcome and will only prolong suffering, it is permissible to withhold or withdraw such treatment. This view has been supported by several major Islamic authorities and fatwas. For example, Egypt's Dar al-Ifta ruled that removing life support machines from a terminally ill patient with no hope of recovery is allowed if qualified doctors confirm that the machines serve no purpose other than maintaining artificial bodily functions. This is not considered euthanasia, mercy killing, but rather the stopping of useless treatment. Similarly, the Jordanian Council of IFTA stated that if 3 reliable doctors agree that resuscitation would be futile, it is religiously and ethically acceptable to withhold it, provided that the decision is made purely based on medical judgment, not with the intention of hastening death. The Saudi Permanent Committee for Scholarly Research and IFTA also issued a similar ruling, allowing DNR decisions when resuscitation would bring no benefit. With the agreement of 3 competent physicians, the International Islamic Fiqh Academy of the Organization of Islamic Cooperation, OIC, announced in 1986 that a person is considered legally dead if the heart and breathing have irreversibly stopped, or if all brain functions have permanently ceased, as confirmed by qualified and trustworthy doctors. In such a case, it is religiously permissible to remove life support devices, as this action is not ending a life, but confirming that death has already occurred and that continuing artificial support serves no purpose. This ruling aims to fulfill the goals of Islamic law, which include preserving human dignity, reducing hardship, and respecting medical expertise in determining death. These consistent fatwas show that Islam maintains a careful balance between 2 key values: the sanctity of life and the relief of unnecessary suffering. It allows medical professionals and families to make decisions that protect dignity and avoid futile medical interventions. While remaining faithful to God's will, Islam clearly differentiates between do not resuscitate and euthanasia. ADNR means refraining from medical procedures that bring no benefit when recovery is impossible. Euthanasia, on the other hand, means deliberately ending a life to stop pain, which is strictly forbidden in Islam because it involves intentionally taking a life that only God has the right to end. A DNR decision is therefore not about ending life, but about allowing the natural process of death to occur when medical science can no longer change the outcome. From an Islamic perspective, DNR represents a balance between compassion for the suffering patient and submission to God's will. Islam teaches mercy and kindness, but it also forbids actions that deliberately end life. When reliable medical evidence shows that recovery is impossible, withholding resuscitation is considered responsible, ethical, and fully consistent with both Islamic faith and modern medical ethics. This balanced understanding helps families and healthcare professionals make wise decisions that respect both the sanctity of life and the natural reality of death. It reminds everyone involved that mercy, patience, and faith should guide every action and decision. In these sensitive moments, preserving human dignity and showing compassion are essential in fulfilling the true spirit of Islamic teachings. In conclusion, DNR policies require a balanced approach that combines medical facts, ethical reasoning, and respect for religious values. Open communication, empathy, and continuous support are necessary to help patients and families face these difficult decisions. With peace and understanding, Islam provides a compassionate framework that honors both life and the acceptance of death as part of God's wisdom, guiding believers to act with mercy, respect, and faith.